I want to share 15 simple remedies that can help provide tinnitus relief. My name is Ben Thompson, Doctor of Audiology and tinnitus specialist. Option number 1 is sound therapy. Choosing soothing sounds like pink noise, white noise, natural water sounds, crickets, or other kinds of sound therapies can help reduce tinnitus in the brain. There is a natural process of the brain called habituation, and when sound therapy can promote that natural brain process, patients are likely to experience relief. This can happen as immediate relief of, I play pink noise and my tinnitus is softer, it's less bothersome. Or this can also take place with a medium to long-term reduction in the baseline level of the sound of your tinnitus. You can play sound therapy through many things. The simplest way might just be through your smartphone. You can also use a sound machine, tinnitus maskers on the ears, or hearing aids programmed for tinnitus. Number 2 on our list for best options for tinnitus relief is for individuals who have a mild hearing loss or greater, and this is hearing aids for tinnitus. It is well known and documented that using hearing aids for tinnitus can provide the restoration of sound into those auditory sections of your brain that are lacking the necessary input, because the phantom sound of tinnitus is actually representing a hearing loss for many of you. So using hearing aids as a treatment can not only improve hearing abilities, but the reason we would recommend it is because it can improve your tinnitus. And while many of you may feel anxious or concerned about using hearing aids for the first time for your tinnitus, just know a few things. Number 1 is that there are many designs for hearing aids that are sleek, modern, and nearly invisible. They're discreet and won't cause any attention or conversations about your ears. Additionally, if you're using these hearing aids primarily for tinnitus, then after your tinnitus treatment program is over, you may not need to use the hearing aids at all. So keep that in mind as you're considering the best options for tinnitus relief. Number 3 on our list is bimodal stimulation. Did you know that when you stimulate 2 of the 5 senses at the same time, there's been research to suggest that it can help improve certain chronic health conditions. In our case, as we're trying to reduce tinnitus, research has shown that when we stimulate certain areas of the tongue, the cheek, or the neck, and at the same time have sound therapy coming in through the ears, that we can have a positive treatment effect on tinnitus, sometimes in a shorter time frame than the standard treatment of sound therapy plus one-on-one expert coaching. Bimodal stimulation helps to promote this natural brain process of neuroplasticity that can help rewire and retrain after a tinnitus treatment. Currently, this emergent therapy is still being tested, and I would say still in an experimental phase. Speak with your audiologist or reach out to our team of audiologists at Treble Health if you would like to learn more about whether bimodal stimulation is right for you. Now I'd like to take a short break from our 15 best strategies for tinnitus relief video to announce a new project I've been working on that can help you with your tinnitus. The project is called the Tinnitus Quiz, and all you have to do is answer a few simple questions. In return, you'll have a personalized recommendation for what to do next in regards to managing your tinnitus. My team and I have set up the Tinnitus Quiz so that based on your responses, it will tell you how severe of a level of tinnitus you have. Additionally, it will give you a customized recommendation to take that next step. So if you'd like to learn more and get started and try this out, you can try it out for free by heading over to tinnitusquiz.com. I will also put a link below in the description so you can check that out. Number 4 on our list is one-on-one coaching, therapy, or counseling. You'd be surprised how much this one-on-one personalized approach can help facilitate the brain's natural ability to reduce tinnitus over time. There's a negative thinking and a negative pattern of tinnitus. We call this the negative feedback loop, where we hear the sound, we start to feel anxious or worried about it. The body goes into this fight or flight state where the body gets tight. We start to feel that stress and anxiety building up. And then the tinnitus gets louder because our brain is in this state of looking for potential threats and trying to keep safe. So tinnitus is seen as a threat, therefore it gets louder, and the process just continues in this negative feedback loop. Now, most of this is happening subconsciously, so you can't control it. Working one-on-one with an audiologist, a therapist, or a coach who specializes in tinnitus can get us out of these negative loops and create more proactive strategies to manage our tinnitus. And I've seen this for years now, the benefit of that approach. So please do consider trying it. Option number 5 is cognitive behavioral therapy. This is also described as CBT. This is a psychological protocol that's used where you can work with a therapist or a psychologist and focus on the standard cognitive behavioral therapy adapted for tinnitus. Similar to the one-on-one coaching, CBT is best performed in a one-on-one setting with a trained professional. It's worth noting that you can get out of that negative loop of tinnitus by having one-on-one education, support, encouragement, and we can get out of these negative automatic responses of tinnitus and replace our negative automatic brain response to tinnitus with a more neutral, practical, realistic approach. So instead of having thoughts or saying things like, this tinnitus is driving me crazy, or I can't stand this sound, trying to replace that with more neutral, practical responses like, this tinnitus is loud today, but I'm strong and I'm going to get through it. Or my tinnitus is fluctuating today and I need to slow down and take care of myself. Using language like that in your thoughts and in your words can have a big improvement. And that's just one example of the kind of strategic thinking that CBT, cognitive behavioral therapy, can help you with. Option number 6, this is one of my personal favorites. This is called tinnitus retraining therapy. This approach was developed by a PhD neuroscientist, Dr. Pavel Jastrabov, who's also my personal tinnitus mentor. This is the modality that most expert audiologists are trained in. The goal of tinnitus retraining therapy is to help the brain reframe tinnitus as neutral and non-threatening. It uses a combination of constant low-level background sounds, typically played through tinnitus maskers inside of the ears, what we had spoken about earlier, along with one-on-one coaching from your audiologist, educating you and making sure all of your questions are answered so that the mind no longer has this worry and this fear of what if or what will happen when. Instead, you have clear, concise information and you have a plan to move forward with your tinnitus. Our team of audiologists at Treble Health specialize in these techniques we're talking about today, and tinnitus retraining therapy is something that I would highly recommend looking into, starting with sound therapy and then having that personalized education on why is your tinnitus there? What can we do about it? How do we retrain your brain in a positive way? Highly recommended. Option number 7 for tinnitus relief includes other types of counseling. So this is not a complete list, but you can try acceptance and commitment therapy, ACT. That's similar to cognitive behavioral therapy, but rather than trying to change negative thoughts, it helps you accept the negativity and avoid fighting it. There are other counseling techniques as well that if you were to go to a psychologist or a therapist, they may recommend. Option number 8 is general health and wellness. While this might not be targeted specifically for tinnitus as a direct intervention, general well-being improvements have limitless benefits for both the mind and the body. By nurturing the whole body health, you're likely to experience improvements in chronic health conditions, whether that's diabetes, cardiovascular problems, or tinnitus. Included in this topic of general wellness is exercise, nutrition. When you focus on exercise and nutrition, you're likely to see mood and energy levels improve, stress is reduced, and you have better sleeping patterns. It may be also advisable to stop tobacco use or heavy tobacco use and alcohol use while you are trying to reduce your tinnitus. Option number 9, meditation, mindfulness, and relaxation practices. It's well known that tinnitus is linked to the stress centers of the brain. So when we focus on reducing stress, we can also improve tinnitus in the process. And guided breathing, mindfulness, relaxation, meditation have been used for generations as reliable strategies to put the mind in the right place and the body in the right place. You can think of this like tuning your instrument. You can have the best violin player in the world and the best violin, but if the violin is not tuned, then it won't sound as good as it can. Similarly, you are the violin and you are the violin player. So we need you and your body and your mind to be tuned effectively. And relaxation, meditation, mindfulness are essentially ways to tune that instrument so you can be more present, have more energy. And through that process, you're likely to experience less anxiety, less stress, less depression, and better sleep. You can try these kinds of methods through free videos on YouTube, apps that are designed for meditation, or working one-on-one with a psychologist who works in mindfulness. I created a 7-day free meditation series on YouTube, and you could also search Tinnitus Meditation Challenge to get started with some guided breathing on your own. Option 10, mental health and wellness. Because tinnitus is so closely linked to the stress or anxiety centers in the brain, focus on your mental health and wellness. This may mean working with a therapist to help with any depression, anxiety, things of that sort. Additionally, you may consider medication if you are having any of these chronic health and mental illness conditions or mental health concerns. You may have that conversation with your doctor of, are there medications that could help me in my case? I'm not recommending any specific medications that's outside of my scope of practice as an audiologist and tinnitus specialist, but it may be worth a conversation to try to see where we can get 10%, 20%, 30% improvements in our mental health. And as a byproduct, tinnitus is likely to be much easier to manage because of that. Option 11 for tinnitus relief is to investigate any jaw or neck pain. The TMJ is this region, the temporomandibular joint, and it connects the two regions of the jaw. So sometimes because of teeth grinding or dental conditions or other factors, you can have a very tight jaw and you can have TMJ disorders. That might originate from misalignment of the jaw, grinding your teeth. That can cause inflammation and irritation of those muscles around the joint of your jaw. So that can often lead to exacerbating tinnitus or making tinnitus louder. Similarly, neck strain, pain in the upper neck, cervical spine, even posture has been linked to louder levels of tinnitus. So that's something to investigate on your own to see if that could be a factor at play for you. Option number 12 is to play sound masking through your phone. Just try to keep it simple here and use something like popular YouTube sound therapy tracks and just have this on in the background at a level that's lower than your tinnitus. We call this the mixing point. So you can have your tinnitus, let's say it's this loud, say 5 out of 10. You can play sound therapy, try to keep your sound therapy at a 4 or a 3 or a 2 out of 10. But if you have it at a 3 or a 4, that's probably a very healthy mixing point. And when you play that sound in the background for hours during your daytime, when it's otherwise quiet, you're likely to notice an improvement in your focus, your attention, as well as a medium to long-term improvement with your baseline levels of tinnitus. Our audiologists at Treble Health focus on this a lot because sound therapy does work for tinnitus. So that's another option for you today. Option number 13 is guided sleep audio. If you're struggling with sleep, falling asleep, or staying asleep because of your tinnitus, finding a YouTube channel like The Honest Guys, that's the one that I personally use, to listen to guided sleep audio. It essentially provides a progressive muscle relaxation technique so that you can drift off and fall asleep easier. Instead of just listening to the voice inside your head, which might be anxious or not able to calm down and settle down, you can replace it with this other soothing voice that's having you guide through this progressive muscle relaxation from your head to your toe. So I typically put on those tracks for about an hour and listen to them through headphones, and that helps me fall asleep even if I had a bad case of tinnitus that night. Number 14, another option for you is to exercise. Use physical movement and exercise to get out of your head. It's been shown that physical activity can help improve tinnitus-related distress. So that doesn't mean you need to start overexerting yourself, but simply move more and more often. Try to go for 3 to 5 times a week. Pursue an activity that you enjoy, that gets your heart rate going, like hiking with a friend, taking a walk, dancing, going on a bike ride, treadmill, going to the gym, something that you can stick to and that you'll likely experience improvement and have positive benefits for tinnitus as well as just overall wellness. Option number 15 is to focus on your pre-sleep routine. Many of us watch TV late into the night, eat food at the end of the night, and don't have very good sleeping patterns or sleeping habits. So focus on the hour before you try to fall asleep and make this as health focused as possible. So for many of us, this means doing a few simple techniques to improve your sleep habits, like setting a consistent bedtime, limit naps during the day, avoid screens like your phone or computer or television before or while you're in bed, keep your room cool and comfortable, below 70 degrees in terms of a temperature if possible, use a low-level sound machine at night. All of these can really come together to create a robust pre-sleep routine where you're settling your mind, settling your body, and then you enter sleep with ease and you can fall asleep faster and stay asleep longer. With tinnitus, that makes a big difference, everybody. Okay, everybody, there you have it. Those were 15 options for tinnitus relief. Those are simple remedies that you can implement immediately. My name is Ben Thompson. As I had said earlier, I started a new project where you can answer a few simple questions and get a result for how severe is your tinnitus. Also with that result comes one of our expert recommendations for what you should do next. To try this out for free, head over to tinnitusquiz.com. You can either just put it in a new tab on your phone or on a computer, or you can click the link below in this video where I've linked that for you. Thanks so much. Make sure to head over to tinnitusquiz.com. And if you want to stay connected to some of my other work here on YouTube, look above here and I'll see you soon. Bye-bye.